Thank you very much, Madam Chair. Thank you, Ranking Member Keller, and I thank our witnesses for appearing. This is an interesting hearing, especially after OSHA having been given millions of dollars of the COVID-19 funding to have a vaccine mandate struck down. And I can speak on this as both a small business owner, as a healthcare professional, as a former director of the Department of Public Health, where some of these policies were misguided. The committee has a responsibility to ensure that hundreds of millions of taxpayer dollars that the agency received in discretionary and supplemental funding during the COVID-19 pandemic has been spent wisely. Mr. Parker, does OSHA have an estimate of how many taxpayer dollars were wasted in pursuing vaccine and testing mandate, which the administration knew was going to be ruled unconstitutional? They even remarked upon that. And given that the rule was ultimately rebuked as illegal by the Supreme Court, do you believe that the federal funding that OSHA received to protect workers from COVID-19 could have been better spent?
I don't have at my fingertips an accounting of the dollars that were used specifically for that rule. It's not necessarily how we do our accounting on a rule by rule basis. But it's something that I can see how much information we can get and provide it to you subsequent to the hearing.
I think it would be very helpful for us to know where those dollars were spent, and if there are dollars that are unspent that could be returned or utilized in a different manner for you to fulfill your mission. I think there are many of us, physicians, former directors of public health, people in the public health sphere, who felt that immunity was the issue that we were trying to get at, which protects ourselves and protects others. But we never heard the concept of immunity. We just heard vaccine mandate and terminating people when there's a labor shortage, and our labor participation rate is not where it was prior to the pandemic, that creating further hurdles, I think, for those in the healthcare field. I'm also concerned about President Biden's budget request to increase agency staffing dramatically. Workplace injury and illness rates have been steadily decreasing for decades. Let me just show this little graph. I'm not sure if everyone can see it, but it shows that the numbers of non-fatal occupational injuries and illnesses have decreased almost by half from 2002 to 2020. I can get those exact figures for you. So given this positive trend, which we all welcome, we want people to be able to go to work, to be safe. Certainly as a former employer and a small business owner, my employees were my greatest asset, and I treated them as such. And so given the positive trend, is the request for increased staffing so that OSHA can write additional onerous regulations and ramp up enforcement more than such as record keeping violations. And I have seen this time and time again as a justification for increased staffing. You should, and OSHA should be partners with our business owners, and especially our small business owners, to allow maximum safety, but also to allow those businesses to continue to operate.
Thank you, Congresswoman. I should first note that, OSHA, a lot of people think about enforcement when they think of OSHA, but there are many facets to the work that OSHA does. It's not only enforcement and rulemaking, but we do a considerable amount of compliance assistance. We reach out to thousands of employers every year. We train more than 1 million workers through both direct training and support of private sector trainers. And so there's considerable other work that we do. The graph that you showed did show significant improvement from the time that the OSHA Act was developed or enacted back in 1970. At that time, there were about 1,100 COSHOs, inspectors, and we're down below, most in the last fiscal year, below 800. So, and if you look at that trend line, it has gotten flat. So I think strongly that when we still have more than 5,000 people dying at work every year, many thousands more injured, it's worth more of that, a factor even higher that are affected by occupational illness. That if we want to get to the next level,
if I may correct you, the graph that I showed you was not from 1970. It was from 2002 to 2020. And the number of workplace fatalities in 2020 was 4349, not more than 5,000. So if I'm hearing you correctly, you're saying that you're going to help with compliance, you're going to help with training. So is it correct to say that the majority of this funding is not going to go to regulatory and punitive measures, it is going to go to compliance and training?
The gentlelady's time is up.
Thank you so much. I yield back my time.
And thank you very much. I'd like to